What's up, Juice Crew, and welcome to the Juice Med. I am your host and creator of the Juice Med, and this is the introduction video. With this video, I'm going to lay out exactly what the Juice Med is, what it offers, and how to use it to get the best out of your medical school education, the best out of boards, and the best out of your medical career, right? So to begin, I want to start off with why I named it the Juice Med. And I called it the juice specifically because I want to bring electricity back into medicine. I always had a motto in med school when I was studying for boards, and it was, if it makes sense, you don't need to memorize it. And that's going to be a goal of this channel, is to make medicine make sense. There's nothing quite like when you're getting pimped on a rotation and your preceptor asks you a question and you know automatically what the answer is. And it's that electricity that you feel getting the answer correct. And it's the electricity you get when you make the diagnosis and you save a patient's life. I want that electricity to carry over into medicine. I don't want medicine to be a chore to study. I want it to be fun, exciting, and I want to bring the juice. So that's, in essence, why the platform became and evolved to the Juice Med. Features that I will offer are a comprehensive medical chart to study from. Now, this is going to be one of the biggest features that I offer. It's going to be in the format of a Google Sheets document. It's going to have a list of diseases that you could ever possibly want to study from and learn about. And it's going to be highly organized in a very methodical pattern. So wherever you need to find information, you're going to know exactly where to look for it. And I'll go over shortly in this video how to navigate this Google chart document. It's yours and you can use it however you wish. I'm also going to offer step 1 and step 2 styled questions. I'm going to have high yield and lower yield content review videos describing all of the diseases that you might find in the chart that I'm going to offer. I'm going to have an Anki deck for you to download and practice any of the concepts. And I'm going to have a feedback form so that you as the user can submit feedback for improvement and quality assurance. So if you find that there's an error in the chart, if you find that there's an error in some of the board questions, then you can submit feedback and then I will improve on and continue to expand this entire platform. So my goal with this channel is to provide a source for medical students to find everything that they could need. Questions, content, and review. I want it all in one very organized location. So let me show you around the Juice Med YouTube channel and explain everything that you might expect and need. All right, welcome to the homepage of the Juice Med YouTube channel. This is going to be the site where you're going to access most of the resources that this channel has to offer. If you click more here, then you'll get a description of the Juice Med and the mission behind what this platform is all about. If you scroll down, you'll have a list to links, and this is going to be where you access the information and the features that the channel offers. So if we start with the start page, it'll open a Google Docs document kind of explaining all of the features that are offered in this particular channel. So we've got the master chart, practice questions, feedback, and a content roadmap that kind of details what videos and questions exist for a particular disease and the organization hierarchy for how these diseases exist within the master chart. If we head back to the homepage, then we can see practice questions. This is going to take us to a Google Drive filled with practice questions that are going to continue to populate as the chart expands. And if we go to disease-specific sets, you'll see Staph aureus is the first disease I'll cover, and I've already created some practice questions for it. If we go to step 1 questions, we can see we have practice questions here. This is going to be a list of step-styled practice questions, and you can scroll through and continue to see that there are a lot that we offer here. And if we head back, we can see that there is also a document for answer explanations. So this is going to tell you what the correct answer is, why the correct answer is what it is, and then why the other answers are wrong, and then give you a key learning objective. And again, this is going to be the case for all of these step-styled questions. So we have it for both step 1 and we have it for both step 2. Now, this is the corrections and feedback form. It's going to take you to a Google poll form. If you click next, it will walk you through a bunch of questions for where and what corrections you think need to be made to either content, video, or board styled questions. You just go through this form and eventually submit it. And within a reasonable amount of time, the corrections should be made if I feel that they are indeed correct and the information needs to be adjusted. If we head back, we are going to go to the master chart. So this is going to be the most versatile and the most powerful thing that the Juice Med is going to offer to medical students. If we click the master chart, it is going to take us to this specific layout, and I'll explain what everything means. So to begin, if we look down here at the different tabs, this is going to be how different information is organized. We're going to start with the pathology chart, work our way to the right. All right, so the pathology chart is going to house all of the diseases, disorders, syndromes, and anything pathology related that you may encounter. So it's going to follow this very structured nomenclature and organization scheme. It's going to start with a overall system, and then a subsection within that system, and then a subsection that is going to be a disease category. All of the types of diseases that fit within that disease category are going to be listed here. You're going to have a description of this disease category and any other relevant information that is generalized to that disease category. Then over here, you're going to have disease specifics. So this will house the name and any eponyms here, give the clinical presentation, complications, prevalence, risk factors, epidemiology, any causes, genetics, and again, a description. Over here is going to be any laboratory or clinical based information. It's going to start with histology, go through gross and microscopic histology, any imaging findings, any laboratory results, physical exam signs, diagnostic criteria, and a clinical vignette, and any grading or staging scheme that exists. And finally, we're going to end with a treatment algorithm. So how do you manage this? How do you work it up, etc. From this cell on and the rest of this row, it's going to be purely image-based documents. So any pertaining images that are relevant to this particular disease is going to be found here from column F all the way through Z. So just as an example, the very first section or subsection is going to be Staphylococcus. You can see here that it is subdivided into all the different types. So a hierarchy scheme would be coagulase positive species. Then you have Staph aureus. That's going to be the specific disease. And then you've got subdiseases. So this indentation tells you the level of specificity within this category. So if we move over from Staph aureus, we'll see that the very first disease we should see is Staph aureus, and we do. It gives the clinical presentation, all of the ways that Staph aureus can cause infection. It gives the prevalence, transmission, and a short description. Now, anything that is not found in this particular disease box is going to be overflowed into the MOA here. If I scroll down, I can find Staph aureus right here. And then all of the excess information about Staph aureus is going to be captured here. This MOA in Staph aureus is supposed to be just a small little blurb about what Staph aureus is. If you want any further information, it's going to be found in column B. If we move over, this is all the laboratory findings, most of which are going to be pertinent about imaging. So a chest x-ray, a chest CT, ultrasound, etc. Especially in infectious diseases, microbiology as a lab set is going to be very, very important, particularly for step 1. So gram stain, catalase, coagulase, and any other identification tools are going to be found here under microbiology. And then we have a treatment algorithm right here. So this is going to walk you through how to work up and treat Staph aureus, what different antibacterial agents that we're going to use. And if you are a visual person, the very first image in every single disease is going to be a pictorial infographic of this treatment and workup diagram. So Staphylococcus aureus right here, this is going to kind of be an algorithm that you could follow for how to work up staph and eventually how to get around to treating it. This is an image of the gram-positive cocci that grow in grape-like clusters. This is going to be beta hemolysis. This is going to be the golden hue that staph emits. And here's a cool infographic of the virulence factors and their mechanism of virulence. So this is going to be standard for all diseases. Every disease is going to follow this particular pattern, and this is how you can easily pull information out. If we move over to the pharmacology section, it's going to give a pharmacologic category, in this case, beta-lactam penicillins. It's going to give the specific drug we're talking about, penicillin G, any brand names. Indications are here. Contraindications would be beneath this if it existed, and then the mechanism of action and other pertinent high-yield features about penicillin G are going to be found in the MOA here. We have adverse reactions, and then any other relevant drug pharmacology that you need to know. So in terms of antimicrobials, we're going to have what the coverage is for that particular antibiotic. In terms of pharmacokinetics, we have absorption, distribution, metabolism, excretion, and half-life. We've got pregnancy category, drug-drug interactions, and any other clinical pearls. Again, here is an infographic of penicillin, its mechanism of action, and its resistance mechanism. It's always good to see this next to the drug. It makes it much easier to study. We pan over to system overviews. This is going to be just general overviews of a particular system. So the first one's going to be preventive medicine, legislature. The next one might be infectious diseases, and it'll talk about bacteria as a whole. We've got procedures, imaging, and clinicals. So under procedures, the first one's going to be a lab procedure. It'll tell you how to perform that procedure and any other pertinent information pertaining to it. Here's another diagram for the specific procedure and how to perform it. Under radiology, this is going to be how specific scans work or radiologic signs, in this case, bone and bone vertebra. It'll show you exactly what that might look like on a scan. It'll show you what can cause it, etc., etc. And then finally, under clinicals, this is going to be major clinical algorithms or schedules or anything that you might need in a clinical setting. So in this case, the first one is going to be the vaccine schedule. So here you can see the vaccine schedule laid out by timing. So at birth, you're supposed to give the hepatitis B vaccine, and it's all laid out here in this infographic as well. What dose, what vaccine, when to give it, all laid out neat here, so you can refer back to it while you're studying. The physical exam section is going to consist of any physical exam test. So in this case, the Police Scratch Test or the Daubon's test. So this will tell you how to perform it, what the test result will mean, what causes it, and then any other pertinent information. And again, a nice infographic to show you exactly how to do it. Laboratory tests are going to be the same way. In this case, the Gram stain, it'll show you how to perform it, what the positive and negative test means, and then give you an example of it right here. So this is Gram positive bacteria. This is Gram negative bacteria. These are going to be any landmark clinical trials. The very first line here is going to tell you just a short snippet of what this trial concluded. If you want more detail, it'll be underneath that. And if you really want more detail about what the trial is, it'll all be under the MOA. The most powerful feature of this is going to be at the index. So this is how each of the diseases are cataloged. So they are organized based on the system, subsection, category, and then the disease name, and any subdiseases that go along with that particular disease, as well as a range name. Now, the range name is important for this feature right here, jump to disease. So if you are anywhere in this particular chart and you run this particular script, it will bring this up. And this is how you can bounce between disease and disease. So if I want to go to Staph aureus, I know it's infectious disease. I know it's bacteria. I know it's Staphylococcus. And then I know it's Staph aureus. If I click open, it will take me directly to that particular cell. And this is a very quick, fast way of bouncing between diseases. If I click Staph aureus specifically, it'll drop down any sub-syndromes that are associated with it. And I can click on those and it'll take me right there as well. And so this is how you can quickly navigate between different diseases or even pharmacology. Anything that is cataloged in this index will be fair game and will be citable and searchable within this. So if I wanted to search for penicillin, for instance, I type penicillin in, go to antibiotics, penicillin, and then I can go here. It even has brand names too if I want to go there as well. And it'll take me immediately to the penicillin chart and I can read whatever I need. So this is a very quick, efficient way of studying, and it's a very powerful tool. If you want to use the interactive search for disease feature, you're going to have to click this link, which is going to generate your own personal copy of the master chart. Then it will ask you a series of confirmatory questions. Just confirm everything and then you'll be able to run the script yourself. One caveat to this is that the copy chart that you make will not update in real time as I make updates to the master chart. You're just going to have to remake a copy of the chart whenever there's a major update. And with that takes us to the end of the first video for the Juice Med and into the introduction. I hope you learned a lot and I hope this will be a valuable tool while you study medicine. So as always, let's try to make medicine make sense and see you next time.